and in whatever time zone that might be. I'm very excited. Scholars presenting today, Julia Lau, who's going to talk about a very timely topic, namely pandemic politics in Southeast Asia. Perhaps there's some lessons here for here in the United States to be learned, as we seem to not really have gotten the memo on this one. But it's really an exciting opportunity both to showcase some new and exciting work from a scholar, but also from a scholar who's associated with the center and is really an important advocate and participant in the intellectual community and the lifeblood of the East Asia National Resource Center and its associated centers such as the Sigur Center. So without further ado, I'll pass it over to Graham Cornwell, who's going to moderate today's discussion, and go ahead and introduce Julia. Over to you, Graham.
Hi, everyone. Yes, as Ben said, I'm Graham Cornwell. I'm the Assistant Dean for Research here at the Elliott School. I'm very excited to host today's talk with Julia Lau, and especially excited to partner with the National Resource Center and the Sigur Center, two of our crown jewels of our scholarly community at the school. So Julia M. Lau is an independent scholar, tutor, and writer based in Phoenix, Arizona, a native of Singapore. She attended the National University of Singapore and Georgetown University. She has graduate degrees in law, security studies, and government. She's lectured at Georgetown, the Catholic University of America, and McDaniel College in Westminster, Maryland. She in international relations and comparative politics. Her current research interests include war memory in Southeast Asia and China, and gender politics. She was a member of the American Political Science Association's inaugural Status Committee on Contingent Faculty for 3 years, advocating for better working conditions and an understanding of contingent and adjunct faculty in political science. With that, I turn it over to Julia. Thank you all so much for attending, and Julia, thank you.
Thank you very much for that very generous introduction. And if you hear a throbbing sound in the background, that is the lawnmower, and today is landscaping day. Prior to starting the recording and we were chatting, everyone's working from home, so this is what you have to live with. If you hear barking, it's my dog. His name is Kopi, but let's get started. So a very formal good morning to everybody from Phoenix, Arizona. Good afternoon for those of us joining from the East Coast, and I know I have at least one friend in Canada and elsewhere. Good morning to those in Hawaii and to those who are staying up late in Singapore as well. We start with this map, and if you don't know Southeast Asia at all, or for anyone who's less familiar with the geography of the place, I like to point out two things. First, Southeast Asia is a region that is extremely connected to the world and has been for a very long time. Connectivity is not just, something that we talk about today, but centuries back, we've been a trade hub, we've been a maritime hub. A lot of the countries still survive on shipping and trade, and the movement of people and goods is a significant proportion of how the region makes its money, makes its living, gets its international and regional influences, including exchanges of culture and goods and just influences from all over the world. The other thing to note, if you see the map, is you will see India and China, basically the two regions of the region, the two giants of the region. India itself is a subcontinent. A lot of people from that subcontinent, as well as Sri Lanka and other states in South Asia, come through or settle in Southeast Asia. In Singapore, Malaysia, Indonesia, Thailand, everywhere, you will see large minority communities of South Asians, right? And these are the people who also are now coming in and have come in to be foreign workers, for instance, in the construction sector as well as other sectors. We'll talk a bit about that when I get to Singapore. China, of course, is the giant in the room, or the elephant in the room. It is the regional hegemon for sure. It has been flexing its muscle for quite a long time. It also, of course, in this case of COVID, was where we think for now, until the news changes some more, at least one great source of where the virus came from in Wuhan. And that was where we found, all the news coming from late last year, early this year. It is definitely influencing how Asia and Southeast Asia in particular is dealing with the crisis. It is also now the chief influencer, if you will, in terms of number of tourists, number of traders, number of businessmen coming through. And so with COVID influencing everybody's tourism and other sectors and investment, this is going to be a big issue, right? Can China make sure that there are no more outbreaks? Next slide, please, Richard. The next slide is just a quick chart. It is from the WHO. And this is just a breakdown to see by region of the world, what is the situation. So Southeast Asia is the purple. And if you look at how little you see the purple in February and March, that doesn't mean that there were no cases. It means that at that point of time, they were not detected. But then if you go on to like look at June and July, even though there are cases and they seem to be increasing, as a proportion of the world population, we're actually right on point. We have about 8.5% of the world's cases, but we also have about 8.5% of the population. Okay, that's for Southeast Asia as a whole. Next slide, please. And so these are just some small points. We can get more into it later if we need to, or during Q&A. And I apologize again for the lawnmower. They should be done soon. It's a very diverse region. It is the flag you see up there is the ASEAN flag. There are 10 countries right now. East Timor or Timor-Leste can also be listed as the 11th country that is not, formally in ASEAN. It's a diverse region. It is something that I think Americans are less familiar with, because generally the American, the average American person would know Northeast Asia a lot better: Japan, China, and Korea, right? Mainly because of the Korean War and other things. And they may know Vietnam, but that's about it. So generally, the region has had experience with SARS. This was the outbreak in 2002, 2003, with repercussions going into 2004. This is an asset, meaning because of that crisis and because of all the bird flu and swine flu that we had following that, a lot of protocols were put in place that we'll get to when we look at the national cases. The other thing is national memory, or if you want to call it national trauma. A lot of the countries lost people during the SARS crisis. And so we'll get to that individually if we need to, or during Q&A. I'm not going to do all in it for now. So if you look at the region, I've mentioned the thing about correlating with our share of the world's population. We are faring quite well, quite reasonably well. There are some political and cultural differences in the 10 countries across the board. I will only talk about 4 or 5 because of time, but we can always deal with other countries, and if to the extent that I know what's going on in those countries. A lot of the differences are slight in the sense that most of them seem to be dealing quite well with it. So where there's differentiation or variation in whether a response has been effective, this tends to be down to, does the country have the infrastructure? Is the country more developed or less developed? That being said, the final 2 points on this slide, there is no silver bullet. I read a BBC article that cited a scientist or a doctor, and she said, this is an illness or a disease that will find whatever chink of armor you have and work through it. And we will see that clearly later on. Each country basically has had missteps. Each country has had weak or blind spots at different stages of the pandemic. The very long-term outlook, I guess it's too early to tell, but if you want to look at the sort of broad repercussions that we can start seeing, I think for at least 1 or 2 generations, meaning next 10 to 30 years, we'll still see repercussions of, if not this pandemic, then what comes out of it politically and elsewhere afterwards. Okay, next slide, please. And I'm speaking very quickly because we have very little time. This is a chart I came up with by entering country-specific data, and I'm sorry for those with eyesight issues. It's very hard to squeeze in 10 countries plus China and the USA, but it was using data from either Google/Wikipedia and or WHO and the country's individual websites to come up with this first chart, which is just cases per million population. Okay, why do you want to know that? It's a good indicator to tell you how widespread the disease is. However, it can also be misleading. Now, the front runner on this chart is the USA, right at the bottom, the longest bar. The second one is Singapore, right? Why is Singapore's bar so long? We'll get to that later, but the foreign worker issue is one that I'll bring up. And the other thing about Singapore is the testing has been way more extensive than has been done in America. So that can explain high number of cases per million population. In the US's case, it's a much bigger country, right? It's literally, multiples of that in terms of population size. And at this point, American numbers are probably still way below what they actually are, either undercounting or under declaration. And the estimates can range widely from anywhere from 2 to 10 times more than what we're seeing right now, which is kind of scary. All right, next slide, please. This is a more detailed chart. It breaks down just the 10 countries in Southeast Asia. The first bar you see, the gray, is just total number of confirmed cases. Now, again, when you deal with data, you can play with it how you want. Indonesia is the most populous nation, right, in the region. Singapore is not. It's the second smallest now. In terms of just sheer number of confirmed cases, again, Singapore has a very high number, but again, this is because of very high testing, right? Indonesia has a high number. We're still seeing it grow every day by quite a bit. The Philippines is also another slightly worrisome hotspot, if you will. And then if you look at the middle bar, that's just number of deaths. You will notice that generally in the region, it is really low. So the good news, if you will, regionally is maybe also because, especially in some other countries that are less developed, the national population is quite young. And we know that, most young people who catch COVID, not all, but most, get away with minor symptoms and or, come out of it fairly unaffected, right? And Singapore has a high caseload, but a very low death toll compared to SARS, and we'll get more into it later. If you look at the other countries like Vietnam, Cambodia, and Laos, and Brunei, the bars are very, very low. That means very low case numbers, very low deaths. Whether or not that means the data is inaccurate is a question we can talk about later. And it's probably better for experts in those separate countries more than me. Next slide, please. So I read a bunch of news. I sat down after making my banana bread for the week. And I try to boil it down to these three things where, for any analyst looking at the situation in the region, how do we pull all this news together? How do we not get information overload? And how do we make sense of it? Or what are the questions that we need to ask? And or what might be the lessons learned, so far, right? It's still changing every day. The first big point, I guess, I would say, is capacity. So COVID has really shown up, even very large, very rich countries. Capacity need not mean how much money do you have. It doesn't even mean how many MDs and PhDs do you have. Capacity in this case for COVID, I think, and if you look at the success stories so far, right, is there government support? Is the citizenry able to adapt to changing conditions? And by that, I mean, we're all chatting before this started. Can you deal with online education for 100% of the children that are school-going age? Can your workforce telecommute for an indefinite amount of time? Is there internet connectivity that is sufficient for all this to happen? Do your people have laptops at home? If they don't, can you get them to these people rapidly enough? Can you make sure that your low-income sector of the population does not unnecessarily suffer because of this lack of technology? Further down the line, we've seen so many losses of jobs in the US and in Europe. Can you retrain and train for new jobs? Can you make sure that unemployment, even though it's a thing that is happening all over the world, that your population will not be overly affected and or can recover from it within 1 to 3 months instead of 3 to 6 months, or worse still, more than 6 months, right? How many people will fall below the poverty line? Finally, and this is, probably Singapore is the best example of this in this region. Do you have the money to fling at the problem? Singapore has been flinging a lot of money at the problem, right? So that's also capacity. Second big point, is your government, is your public health system credible? Are the things that you're telling your people credible? By this, I mean, is your public health messaging clear? Do your people trust the governance coming at them, right? Whether it's national / federal or provincial or state, do they believe the leaders telling them things, right? Put on your mask, wash your hands, whatever. Do they also believe broadly that the government is able to navigate this crisis, right? Do you have trust in a bigger sense? There are some troubling things that we're starting to see, although I think it's still too early to tell. There are some opportunistic politicians or administrations who are holding elections, in Singapore's case, later today, July 10th, or enacting potentially worrisome regulations. In the case of Thailand, they declared a state of emergency by decree, and we'll talk a bit about that later. Then the final thing I think is, and we've seen this over and over again, coordination is very important. This is truly, in the Singapore civil service, of which I was a former part, a very small part. We like to throw around the phrase whole of government, and it was, maybe a bit trite, but this pandemic has really proved itself to be possibly one of the most significant whole of government challenges we've ever seen, the world has ever seen, definitely in terms of the impact, the scope, and how it's still changing and surprising people, on a daily basis, just about. So a lot of people called it a black swan when it first came out. Arguably, it is not a black swan. I've seen a phrase that I prefer, which is a gray rhino, meaning something's coming at you, you can see it coming, but you have no idea how big or heavy the rhino is and whether you will die. And we can talk about this later on. And I'm being a bit flippant, but I think it's a perfect metaphor. And then finally, even if you think you have a very good government, there are revelations now where that the government and or the population is not able or weakly equipped to handle it. Before I move on to the individual countries, I want to cite one report that everybody, I think, should read. It was co-written by my Georgetown Security Studies classmate, Miss Eleanor Nora, who's currently in Hawaii, jealous, and her colleagues at the Institute for Strategic and International Studies in Kuala Lumpur, Malaysia. She's Malaysian. It has country-by-country analysis. It's written by experts way more qualified than me. It's in the resources for the podcast that we taped yesterday. So I highly recommend that. Very good read. All right, next slide, please. So I will start with Singapore, partly because I'm from there and I devour the news on COVID in Singapore every day, more than once a day. First thing to note is SARS came to Singapore and we were very affected by it. We lost 33 Singaporeans. This is out of 238 cases. I was still in the Ministry of Defense at that time. And one of the first things I remember was we had to start planning for a 50% workforce, meaning if this were to be an outbreak nationally, right? How do we switch to 50% of the people coming in? How do we carry the workload at 100% with 50% of the people? So I'm using this example to show you how long ago some systems and protocols were put in. And this did affect how we responded to COVID. So far, we have had 26 deaths from COVID directly. The current number is more than this 44,800 from 2-3 days ago. The current number is 45,423 cases, which brings the percentage of deaths over cases to just 0.05%. The reason why I give you that percentage is to show, even though it's such a large number of cases, the number of deaths actually has been very low. Like certainly if you compare it to the SARS death toll, it still hasn't, hopefully it will not get there, but it still hasn't hit that. Initial indicators of progress, the reason why I put initial there is because there were a couple of stumbles made, and we'll talk about that on the next slide, but not yet. It's a small country, right? It's very easy to shut Singapore down in the sense of, if we wanted to shut our borders, it's fairly easy to control. Anybody trying to get in will get caught typically, right? They still try though. It is small also, and in terms of population size, and that means that you can roll out measures quite thoroughly. Very few people will miss public messaging. Very few people will refuse to do something, and this is a slightly different reason. You have very strong laws and law enforcement, so you're able to compel performance or enactment of certain actions. Deep pockets I've mentioned earlier. So Singapore has thrown about Singapore dollars 100 billion with a B to throw. They've thrown this at the crisis. They've given cash to almost every citizen, just about, I think, every single citizen. They've had 4 budgets this year. Budget is typically discussed and deliberated in Parliament in February. They passed the original one, but because of COVID, they came up with 3 additional ones. They all have names. They're called the Resilience, Solidarity, and Fortitude budgets. And this just shows that, if you want to deal with it this way, right? If you want to make sure that your citizens are not poor, right? Because they maybe lost their job, or because now, mom cannot work because she's got COVID. We're not seeing the kind of human tragedy stories that we see a lot in Europe and the US. We're not seeing widespread, we have unemployment, but we're not seeing widespread suffering, hungry children, that kind of thing. By and large, this has dealt with it so far, right? They're also, aiming to retrain parts of the population to take up different jobs, and they're, one of the first jobs that they were hiring for were contact tracers and people checking people's temperature and tracing people at entrances of buildings. And then finally, there was a deliberate decision to close offices, schools. I've mentioned the shutdown of the borders, control foreign inflow of people. It's easy, but not painless, meaning this was done at a huge cost to the Singapore economy. And the tracing part of it is important. Any success story you see in the world, not just in Southeast Asia, has to involve close contact tracing, a very sort of dependable system of identifying where the disease hub is. And then this last one is debatable, whether it's a good thing or a bad thing. We joke about Singaporeans being compliant, but in this case, it's really a crisis that needed your general population to at least listen to instructions and carry them out, more or less quite well. There have been interesting cases of people punching social distancing ambassadors and generally misbehaving, probably because of other stresses coming with the pandemic and sheltering in place. But by and large, the population has followed the rules. All right, next slide, please. However, and this is the bad news slide, and I'll maybe sort of dwell on just the one point at the top. There was a giant oversight and/or blind spot. I refuse to buy the excuse that we didn't see this coming. That's rubbish. We have over 300,000 foreign workers from countries like China, Myanmar, India, Pakistan, Sri Lanka, you name it. They generally work in construction. They lived in cramped conditions, 10 to 20 to a room, shared kitchen, shared bathroom, sometimes in a terrible state. Workers' dormitories are run by generally private companies, although some have close links with some political elements, let's just put it that way. So it's a big problem. They did not see this coming, and they were congratulating themselves on a good performance, but then the dormitories became clusters of COVID infection. I wouldn't say overnight, but the only relief is we've done a lot of good testing since then. There are pledges to make their living conditions better. They are also making sure that if any worker is tested positive, he gets, and it's typically a he, just about, he gets put in a hospital and/or a place where they can treat them, and they are also quarantining anybody who is, sharing that room with the infected person. The other problem with this separation, so in Singapore statistics, they separate what they call community cases, meaning citizens and permanent residents, from foreign worker cases. I think this is doubtful ethically, at least, if not politically. It's caused some xenophobia. I'm generally a liberal. I hate people who are racist. It's a very strong word to use, but this has caused a lot of cultural and other debates to go on, which is wonderful because, again, we're going to vote in the government tomorrow. And this has raised some interesting questions about where do we want to see Singapore going forward? Is this the right way to handle it? I'll end on the final point on the slide, which is they're expecting a drop of at least 4 to 7% of GDP for this year. We've also drawn down and will draw down Singapore's reserves. So going forward, it may or may not be sustainable to keep flinging money at the problem like this. Okay, next slide, please. We're going to move on to Indonesia, and I'm sort of tackling these countries in order of how familiar I am with their infrastructure and setup, and or how much time I've spent in them. So Indonesia's current death toll is 3417, not 3241 on the slide, as of today. The case load has gone up to 70,736, up from the 66,226, but it's still at about 4.83%. Why the good news? Generally, I think the current president, Joko Widodo, is doing a good job. He is very serious about the crisis. He has actually scolded his cabinet for initially being a little bit lackluster in their response. There is a threat, I don't think it's been carried out, of possibly a cabinet reshuffle. If you go to the health ministry website, so in Bahasa, it's the Kementerian Kesehatan. They actually have a very comprehensive ministry website. There's a hotline to call if you think you have COVID. There are cartoons on the side to show what the symptoms are. And this is helpful, even though there's a very high rate of literacy. Still about 4% of the population cannot read or write. So they show you, okay, if you have a fever, if you're coughing or whatever, please come in or please get checked. There are clear statistics on this website on number of cases in the country, what the death toll is. So it looks like they're being very clear on communications, right? And I think, the death toll in a country like Indonesia could be much higher if the public messaging was not as clear. And then the last thing I would sort of attribute this sort of fairly good performance to would be what I call individual responsibility. And for me, I don't have access now to, classified information or anything, but just anecdotally, and even from my former teachers in Jogja, which is Yogyakarta in central Java, they posted on Facebook little drawings done by their kids, telling people to wear a mask, wash their hands. So if it's trickling down to the level of the elementary school child, and people are generally being careful about distancing. I know some of my teachers haven't been able to see their grandchildren. So individuals are taking responsibility for their health, which is wonderful to see. Okay, there's always a however. So in this case, the however is the death toll and or the case numbers are likely to be inaccurate, maybe even highly so, because initially there was denial. Initially it was, oh, we don't have any cases, right? And that's complicated. The other thing is because of the spread of the country, there's more than 17,000 islands. It is very hard to know if your numbers are accurate, especially in the more outlying islands, which are, pretty rural. Next slide, please. The champion of this sort of wishful thinking and or, initial misstep was probably the health minister. He basically attributed it to prayer. And I'm not knocking religious people, but he said in mid-February this year, we owe it to God, basically, that there are no cases. That's not a helpful attitude when there probably already were cases flying around in Indonesia. Further down the line, definitely there'll be economic hits coming. They've probably already started generating the numbers in terms of data of how badly the economy will be hit. Tourism is a big one. Indonesia depends on tourism a lot. Bali, places like that are trying their best to restart tourism. Bali for sure is discussing with Australia and New Zealand a possible green lane type of situation where if you're certified to be COVID-free, you can come into Bali, and Bali has done a pretty good job of controlling COVID in and of itself in that province. More sort of lightheartedly, I guess, there is apparently a COVID baby boom. I don't know how they know that. Probably there are a lot of newly pregnant moms going in for checkups. They fear that this may be coming in about, call it 6 to 9 months from now. this is probably a generational problem. Maybe in 10, 15 years, you will see like an issue coming in, education or employment, and maybe increased poverty, but it's too early to tell. And finally, it's just a matter of Indonesia's size, right? It's such a big country. It's going to take a large toll on the population. Big questions about if everyone has to keep going to school online, at least for part of the time, will it then lead to more inequality? It's already a fairly unequal country in some respects. Will this get worse? All right, we'll stop there for Indonesia. Let's move on for the next slide, please. I have a lot of Malaysian friends, and Malaysia is actually a success story that I think has not been given as much credit in the international press as it should be. BBC, I think, and The Guardian have written pieces mentioning Malaysia together with other countries in the region, but it's actually a very bright story. So the current death toll is 121. This is out of slightly under 9,000 cases. If you take it as a percentage, it's about 1.39%. And the first thing that they did, which was very sort of clear, was a movement control order. And this has been extended by a different name to be the Recovery Movement Control Order, or RMCO. It's going to go in place until the end of August, which happens to be Malaysia's Independence Day month, just like Singapore's. These were prudent moves, meaning they're stopping people from moving from state to state. Malaysia has 13 states. Initially, it was doubtful whether this could be controlled because the sort of rise of COVID coincided with, just prior to the period of time where people would start visiting their relatives back home for Hari Raya Puasa, end of Ramadan. There's a very stern and highly enforced mandatory 14-day self-isolation for anybody coming in. If you're a Malaysian and you come back home, you now have to be on home quarantine, and this has been in place since April 3rd. There's a very sound bureaucracy. There is the ability to implement policies, relatively clear communication. After the initial, again, this wonderful health minister, in this case, he said, please drink warm water and it will kill COVID. But the Health Ministry Director General, Dr. Noor Hisham Abdullah, said, nope, please, that's rubbish, please don't. So that's wonderful to see. All right, next slide, please, for Malaysia. There are some reasons for sort of concern. That again is the economic front. Generally in the region is not looking good, but Malaysia also happens to be a country that does depend on tourism revenue. It's definitely plunged. There's going to be unemployment. There already has been. Whether or not they can continue to contain COVID when Malaysia reopens to the world in August, or unless they extend it, right? Future foreign transmissions to me will be probably the most serious spot on this country. So they do get a lot of Middle Eastern tourists who are Muslim and who like to come to Malaysia because the food is halal in general. They can travel with less concern about harassment and other issues. The culture is in some ways not entirely similar, but it's easy to travel, right? So the big question will be when they reopen to tourists, will there be outbreaks coming from this? All right, we'll leave it there. Let's move on to the next slide. I'm going to dwell just a little bit on Thailand. I know less about Thailand at this point, but I did do some research into their health system and all that. Same kind of clear messaging, sound public health system. There's also some cultural issues here. They're very good on hygiene, right? And there's sort of down to the student level, a very high sense of personal responsibility. Thailand is about the only country, except maybe the Philippines, where we see there's a potential danger of a political clampdown, right? They've declared emergency, like I said, it's by decree. They do have arrest powers. They do have the wide-ranging authority for police and other civilian officers to arrest people and or enforce law, depending on what they see to be the problem. It's very widely worded. If you look at the decree, it's available in PDF in both Thai and English, 7 pages. And then again, tourism is an issue, although Thailand's already starting to figure out, how do we get people back in to travel, right? All right, next slide, please. We will end the country part of it with Vietnam. It's not a country I know terribly well, but what I found interesting about Vietnam's situation very early on, it was probably the earliest mover in the region. In early January, and this is before any confirmed cases, Vietnam's government was already preparing for whatever was going on. Right at that point, it only killed 2 people in Wuhan. That's how early they were. When the first virus case was confirmed on 23rd January, Vietnam, this was a man who traveled from Wuhan to visit his son in Ho Chi Minh City. The emergency plan was already in action. So quick action, right? This probably is explained by SARS, right? The experience in Vietnam clearly, affected how quickly they responded and how good they were at detecting this initially. So very rapidly, they put in place measures that other countries in the region and elsewhere would take months to move on. This include travel restrictions, close monitoring of cases and contacts, eventually closing the border with China, increasing the health checks at borders and in other vulnerable places. Schools were closed for the Chinese New Year or Lunar New Year holiday in the end of January. Schools remained closed until mid-May. A very labor-intensive contact tracing operation got underway. And most health experts will attribute this to Vietnam's experiences with past pandemics. The other contrast maybe with the US, if we want to talk about that, the costs for anyone who is being tested and anyone who's being quarantined, the costs are mostly covered by the government. And about 40% of the confirmed cases are actually asymptomatic. So that shows you the extent of the potential problem, right? If you don't test aggressively, you're not going to catch a lot of the cases. There is a mixed public and private health system, and it trickles down all the way to the village. So you have provincial, district, commune, and then in small villages, even in the mountains and the highlands, you have individual village workers, like social workers, going house to house. So it's a very comprehensive system that can be rolled out at very low cost. They only spend about 6.6% of their GDP, but they're getting the job done. Next slide, please. So I know I'm going slightly over time, and I'll stop soon. But this will maybe be a good way to end. Psychological impact of COVID and aftermath. These are things we're starting to see right now. Generally, we don't have a lot of good statistics yet, but we have had anecdotal evidence that there are increased cases of abuse and violence. Sadly, mostly for women and girls, right? Although there are sufferers in all groups. There are also mental health issues that are coming along, and this stretches again across the entire population. The economic repercussions we've talked about a lot, and then, finally the politics of it, right? What will happen post-COVID? We don't know. We just have to wait and see. Next slide, please. So I'm going to leave it here. I'm not going to answer these questions, but these are some that I threw out just thinking about it, and we're going to go into Q&A, so I'll stop there. We can leave it up for a while and then maybe move on to the next Q&A part of it. So I'm done, just about. Thank you.
Julia, thank you so much for that great presentation. The floor is now open. If you have Q&A, please type them not into the chat box, but rather into the Q&A portion just below that chat box, and we'll share them with the group.
Graham, do you want me to talk about the survey, or would you like to?
Oh yeah, well, I can go ahead and mention that. I was going to wait till the end, but please
sure.
scan the survey, the code here, and just to answer a few questions about the event and your experience of it, be very helpful. Just takes a minute, promise. Okay, I mean, we can.
Are there no questions?
None yet.
Okay, that's a very polite audience. Sure. If you have a question, go ahead.
Yeah, we'll be happy to take the prerogative here and ask something. And so I'm very curious about perceptions of the way the pandemic has been handled in, say, Singapore, a great example, and how Singaporeans are looking at other parts of the world and how they've handled it. Sort of like maybe criticisms or even concerns that that their extremely effective response, even though it may be unique to that particular context, that their extremely effective response might be undone 6 months, 9 months, 12 months later by others, sort of, let's say, more lax response to the pandemic.
Right. So there's a wonderful line from somebody in one of those articles that I read from The Guardian or the BBC, and that was, the country that succeeds in controlling this is the country that listens to its public health experts and doctors, and not the politicians. It's a beautiful, beautiful summary of what should be done. Now, I'll tell you a personal anecdote. So I flew from the US to Singapore in sort of late February. I was asked to bring, this is for Chinese New Year, right? Oh, sorry, late January. I was asked to bring hand sanitizer from America to Singapore, because at that time they were running out. That's how early it was. I did 2 trips, and then the second trip I was flying back from Singapore to America in about mid-March, and people were giving me hand sanitizer to carry back to America. So I bring up this example to show, literally as the pandemic wave went through Asia and then started hitting the US, right, the way we see it, I think people in Singapore, because we're such a small country with a lot of people overseas, in various parts of the world, everyone in my family, I know, and a lot of my circle, my friends, have been sort of glued to their TV sets and glued to the newspapers, reading, voraciously about, first, what the disease can do to you, but 2, sort of comparing and contrasting situations in Europe, in the Americas, in Asia, different parts of Asia. So I think Singaporeans, regarding Singapore and the way the government has handled it, there's generally still a high level of trust. Everybody was given free masks. Every household had, I think, 4 or like whatever number of people you had in your household, you could get a mask for that person, right? And it's reusable. And this was quite early on. And I think they've had 3 rounds of mass distribution. So when they read news about countries that are either running out of masks or where the government doesn't give them anything, then they're like, why is that the case, right? Then perceptions of other regions. So I live in America. I'm married to an American, and this is, really an issue that hits cross borders, because now, personally, for instance, I don't know, how bad it will be here, and I'm worried about my extended family here, right? But I have my family in Singapore worried about me here. And I've had more than one person tell me, just come back, just come back to Singapore. You'll be fine. You'll be taken care of. Please don't die there. I'm like, okay, that's a bit morbid, but But so on the personal level, that's going on. When you look at, I think, society as a whole, I think for me, if you look at the amount of discipline a society has, and I use it in a way, I know a lot of people will not find this popular, right? But the reason why I think most of the Asian countries have dealt very well, so we haven't talked about Taiwan, we haven't talked about Korea and Japan. There is generally a high level of discipline, meaning all the way down to the youngest child, right? If you're to distance, not talk during recess, wash your hands, wear your mask, keep it on for 6 hours, even if you're uncomfortable. There's a very high level of compliance, generally, I would guess, right, across Asian countries, right? Then the thing I'll end on is attention. The governments in these countries have sort of good attention spans. They don't try to look for the next big issue or change the subject. So I see there's a question from Elena, and I think you can move on to that, but I'll end here and then maybe we can look at, I see about 3 questions. And I hope that answers at least partly what you asked.
Of course, thank you, thank you. Yeah, to our participant, our audience Q&A here. So, politicians in Southeast Asia, would you say they've weaponized COVID in a way that is unconstructive, rather, to containing the disease?
Wow. to the person who asked that question, can they clarify what they mean by weaponized? Or like, do they mean like specifically in terms of politics? Is it possible?
Yeah, I mean, maybe politicized.
Okay.
We're getting a response. Yeah, I would say politicized COVID in a way that is
Okay.
Let's translate it that way.
Well, some incumbents have used it. Singapore, for instance, has used it to convince the population, or try to convince the population, right? If you believe in us, if you trust us to deal with this crisis and other crises, we're in a battle for the existence of our country. Please vote us back in so that we can keep dealing with this pandemic to serve you better. So that's one very clear way of operationalizing this pandemic. The Thai government, by introducing this state of emergency decree, has definitely put opposition and other people on notice, because you want, while you want your population to be able to handle the crisis effectively, definitely NGOs on human rights and even the UNHR experts have criticized this move as potentially muzzling free press, because one of the clauses talks about clamping down on rumors or untrue statements regarding COVID, and there's a punishment, like if you try to spread rumors about this or tell falsehoods about this. It reminds people of probably the law that was passed in Singapore about fake news. So all these are ways of weaponizing that we may not see the entire repercussions of until much later, right? But so those are probably the two: politicking in a sort of very clear way, like electioneering, but like more insidious ways, maybe by like imposing a state of emergency and not lifting it until maybe even until the pandemic has passed, right?
Okay, thank you.
Yep.
On to another question here.
Yep.
How do you think religious leaders, the religious leaders' messaging factors into public decisions and perceptions in places like Indonesia and Malaysia?
So that's a great question. I don't know too much about that part of it, and I would just confess, that up front. I know that that initial statement that I mentioned about how the health minister said, we're COVID free because prayers have kept it at bay. That was not helpful. But if I'm not wrong, I'm sure by now, definitely at the sort of congregation or mosque level or the imam level, right, in Indonesia, I'm sure by now it's trickled down because it's gone through the public health system and schools as well. So everybody now knows you need to keep your distance. So I don't know that I've read. I don't think I have seen anything that says religious leaders are not, at least not unified in the way they're presenting this message. I think everybody now knows it's a threat, right? So I'm hoping that answers the question. And I can do some homework later. But.
Okay. On to a new question. The bubonic plague has just been reported in China in the press.
Yes.
Is the Chinese government cooperating with the WHO on this? And are they allowing outsiders access to the area? Or is this just assumed to be a non-issue?
I'm charting it as a non-issue for now, because if I'm not wrong, when they first announced it, it was an isolated case, and they said there was no fear of it becoming the next big thing, at least not for this week or this month. We'll check in on the next, bubonic plague in Southeast Asia podcast or webinar. Good question, though.
Okay. Can you speak perhaps a little bit more about regional cooperation in Southeast Asia?
Right. And that's from my friend, and she should actually be the one answering this question.
Okay.
So no, I'm just kidding, but there is ASEAN, right, as a whole. There is sort of there are mechanisms in place to discuss issues, including emergencies like this. Very early on, I'm sure there were calls. So again, I'm saying all this without insight or knowledge of actual confidential conversations, but I would not be surprised if there have been multiple sort of track 1, track 2, track 3 meetings across the board. There's for bigger countries like Indonesia and the Philippines, which are also less developed, there are sort of military to military ties. We didn't talk about this today, but in the podcast that we taped, the TNI, the military in Indonesia, for instance, is helping with COVID, logistics and all that, plus the response. So definitely, I know the SAF, the military in Singapore, would have started talking to their counterparts, and Singapore also does training in other countries, so I'm sure that would have come into their radar as well. In a way, ASEAN functions like a brains trust, right? So they do have ministerial meetings. I know that there have been at least bilateral meetings between leaders. They're so well distanced socially, they're online basically, right? So I'm sure that the 10 ministers of whatever relevant portfolio will be meeting and have been meeting. Officials as well will probably still be, emailing back and forth. I don't know that there have been specific announcements as a region. I think everyone's been firefighting nationally, but I stand to be corrected because that's not something I'm looking at closely right now.
Okay. Next up, a question from Robert Davis.
Sure.
What effect do you believe the virus is having or may have on the flow of refugees, especially the Rohingya, out of Southeast Asia?
So I think the first thing to generally say would be, if you're a stateless person, this will be a terrible time to be one, right? That's one. I am not familiar with actual statistics, but I know there was one good news story where the refugees who were trying to flee to a particular island in Indonesia were rescued by the villagers who basically flouted, these social distancing rules to save these refugees. We know that the first deaths of Rohingya occurred in Bangladesh. They were reported in June, but I think there might be a time lag. There must be cases that we're not seeing and not being detected. But given the conditions of these camps, right, they're very crowded. We're going beyond Southeast Asia now into South Asia. There's no way a million refugees in a crowded camp are going to deal well with the virus spreading. So if anyone's interested, there was actually an NPR episode, and I think it's available online maybe, or at least the transcript is, where Bangladesh has declared parts of the camp a red zone, and they basically clamped down on the area. You cannot go in and you cannot come out. But I fear that it's going to be like the cruise ship situation, right, where people inside who are locked down will just keep spreading it around. So yeah. I'm not optimistic. For Southeast Asia itself, it may make governments in general more wary, but already as a region, it's pretty tight in terms of it's very hard to come into some of the Southeast Asian countries as a refugee. If you're coming into Singapore, you're not going to be allowed to take up residence typically, right?
Okay, thank you. Our next question comes from Cody Griggers. It is, given the interconnectivity of the region as mentioned, a more coherent regional response would seem to be prudent. What's your assessment of the role of ASEAN in this crisis and response recovery?
Oh, I would expect ASEAN to already be working in task forces and teams on this issue. Singapore, for instance, has an inter-ministry effort, right, and team that meet very often, and I'm sure they are talking to their counterparts. The other sort of next big question is, when do we all reopen? And if we reopen, can we reopen safely? So I would not be surprised if people working in the tourism and economic sectors are talking furiously, likely often. The other part of it will be bilaterally. So this is sort of sub-ASEAN, right? It's not 10 countries as a whole, probably, but bilaterally and trilaterally. In Singapore, for instance, many Malaysian students and workers commute daily. They come in from Johor, which is the closest state to Singapore. They come in on a bus or in a car, or they used to. So one of the first very urgent things to do is, how do we get these people safely in and out every day, if that's what they're still going to do, right? And make sure that it doesn't lead to another outbreak. So do you trust, it's kind of like we're talking about podding households, right? You're kind of like podding countries. So can we get ASEAN maybe to a state where, like, the EU, for instance, has now reopened for tourism? We trust that every member country in the EU is handling it. That's a big trust to put in, a fellow member country. So I'm assuming that ASEAN is hopefully right on the track of doing that, but I don't think we're there yet. Yeah, that's all I have to say, I think, on that. And I'm still seeing just the 3 questions, but I know there are more coming, hopefully.
Yeah. We have a few more here.
Yep.
The question here is from Tracy Clausen. Do you see the WHO as a guiding thumb for public safety communications and their strategic and tactical responses, maybe particularly via social media?
Can you repeat the first part, because I couldn't hear the interference.
Of course. Do you see the WHO as a guiding thumb for public safety communications and their strategic and tactical responses via
I think so. I mean, I've used the WHO website quite a bit, and I think the messaging is quite clear. It does take some wading through. There's a lot of information being thrown at people. I do not follow them on social media, however. I'm a bit antediluvian. I do not tweet. I only have Facebook, and nobody else is supposed to find out because that's a non-professional Facebook. But I think WHO is trying its best. I know there have been sort of, missteps and like inconsistent or sort of conflicting messaging. At first, they were not sure about masks, then they were not sure now whether it's airborne or not. Increasingly, we think it's airborne. That's going to complicate life, multiple times more. But failing global leadership by a superpower that shall not be named, the WHO for us is about the equivalent of a global bat signal, right? It's, Batman signal. But I think it can only be as strong as the member countries. It can only be as strong as people trusting the institution. And maybe that's where it breaks down, right? I think across the board, there is sort of diminishing trust placed in international institutions. And maybe a global institution is too big to handle this in this sense. It can give us aggregate statistics, but the strongest responses are national ones and then regional ones in this case, I think.
Yeah. Okay, let's we have about 5 more minutes or so. Okay. Time for a few more questions.
Sure.
This one comes from Krishina Ramani. Mm-hmm. Is what do you think will happen when the vaccine comes out? I.e., how will these countries handle it?
First will be who or which company is the one that comes up with it. The Chinese, I know, are aggressively trying to come up with one. There are private companies across the West also desperately trying to trial vaccines. I think the first question is access, and then the second one is cost, right? And they're two sort of intertwined questions. Even if a vaccine is proven tomorrow, right, to be effective, one of the very first questions will be, does it really work across the board? And secondly, is it going to be like a flu vaccine where it's hit or miss 1 in 3, right? All of us who teach or used to teach in college campuses will know if you get your flu shot, there's still a high chance you'll catch that virulent undergraduate flu and be late on your back, for 3 weeks. So the vaccine itself is a sort of maybe a false silver bullet in the sense that even if we get one, even if it's effective, then the question is for how long? Does it keep morphing every year? Do we need to get a new shot every year? Then access and cost is, can we provide this to every single human being on the planet every year if need be, at no cost or low cost, right? In this sense, then I would say a country like Vietnam, for instance, is going to be much better equipped because they have a socialist system, right? They have a mixed system now, which is private-public, but the cost to the individual at the end of the line is very low. In a country like America, sadly, I think it's going to be crazy. It's going to be as bad as we've seen. You're going to run out of the vaccine, just like you've run out of masks. It may go as high as $1,000 a pop. Who's going to afford that? So it then becomes a question of, is it a human right, to have a vaccine? And I think that's a question I don't think the world is prepared to answer yet. So yes, I'm pessimistic today.
So dark. Okay.
I know, right?
Great to hear from you. Our next question comes from Elijah Patton. Elijah's one of our Asian Studies students here. He asks, what impacts can be seen from the workers towards their governments with a lack of adequate health care or unemployment insurance? Schools have been closed. Will there be a backlash? Can
I question if he means in America? I'm not sure if he means the region. I haven't seen that so much in Southeast Asia, I think.
I think I'm just assuming the question refers to the region.
Okay.
Yeah.
I don't know that I've read about too much. I mean, I've read about general concern, right? People losing their jobs, some grumbling about inadequate protection, but that's typically not really directed at the government, more like at the individual business owner, if that makes sense.
What
Eli,
about in,
okay, wait, hold on.
yeah,
Helen is saying Eli said in
Indonesia?
Indonesia, for example. I would just say either I haven't seen it yet. I haven't seen it come across in a big way. I might be missing it out because I wasn't looking out for that. But I think, okay, for Singapore, for instance, your insurance is not tied to employment. And this is also the reason why I asked whether you meant, you know, specific to the US. The US is one of the very few countries where the minute you lose your job, your health insurance goes, right? In Singapore, if you're low income, if you're uninsured, you know, you can still walk into a doctor, they'll still see you. And if you're definitely, you know, low income and you cannot afford to pay, it will be given to you free or close to free. It will be subsidized severely, right? So that issue doesn't arise. In Indonesia, I am not entirely sure. I'm assuming they'll have some kind of baseline, again, coverage for, you know, the extremely indigent part of the population. Those who can afford it, it's a very highly unequal country. I'm assuming those who can afford it will either, and they've flown to Singapore in private jets to get treated for the virus. The poorest ones will be taken care of, I'm sure. And the other safety net is actually religious, right? So your community will take care of you, or, you know, maybe donations or whatever. Is there a backlash for schools? So Singapore closed down its schools, but went on to completely online, and then a hybrid where you go to school 2 or 3 days a week, and then do online classes. Now it's full time, technically, sort of back at school. But the older the kid, the more able they are to function online entirely. There's some backlash in the sense of, again, you know, people were not sure initially how to handle it. My own sister is a teacher. She's married to another teacher. Logistically, it was very hard for parents who were teachers and had school-going children, right? Imagine you're teaching all day, but at some point you have to figure out that your kid is still logged into Zoom or whatever, right? Elijah then mentions rural workers. I don't know. I just, that's, you know, a blank from me. I haven't seen anything in terms of actual protests or backlash in that sense.
Sure. Okay.
Other countries' lockdowns, I don't know what that is. Rebecca Gluckstein. Oh, I see. It's.
Yeah, I'm happy to share that one just in case I see it here.
Yeah.
Sorry, can you hear me? My audio's.
Mm-hmm.
Yeah, I'm good. I'm back. Rebecca Gluckstein asks, this is more of an opinion. I wonder how effective Jokowi's government really is. In Jakarta, he was on semi-lockdown for 3 weeks and reopened for a month to ascertain whether to lock down again. This time compared to other countries' lockdowns sounds okay. Yeah, sure.
That's a good question, and I guess it takes us back to the idea of discipline, right? How much discipline do you have to? It's starting to be very evident that there are going to be huge mental health repercussions. Even being locked down for a month is a hard thing to do, but Singapore, for instance, you know, they didn't call it a lockdown, but it was about 2 or 3 months at least of, you know, very minimal interaction. It really does take a toll, and to the point where now I think most psychologists are saying, even at the risk of people catching it, even at the risk of children maybe getting it, they have to go back to school. They have to go back to, you know, interactions with human beings, because, you know, this is not going to work. For Indonesia, I think it's also very hard. Jokowi has a really hard job because it's so densely populated in Jakarta. And if you look at the provincial breakdown, East Java, which is the most populated province, right, of course, has the highest toll, death toll plus caseload. This will only go up because I'm assuming the numbers are all severely undercounted. I don't know that we can blame him for being ineffective. I think it's too early to tell, but I think for the population size, so it's 4th most populous, it is not number 4 on the death toll or caseload list. And that's how I judge it, right? America, by comparison, has 4% of the world's population, but 25% of the cases. Something is very wrong. China is way down on the list. I think it's 23rd. Canada is 20th. Indonesia should be much higher if he's being ineffective. But I think people have also taken responsibility into their own hands, right? And maybe that's helped, you know, to control the numbers somewhat. I think Graham, I'm sorry, your mic's off.
Thank you. That's it for our questions and all for our event today. Julia, I want to thank you so much for taking
It's been fun.
So thorough, so interesting, and especially to our participants and our audience. Thank you for
the questions.
Posing questions. Yeah, absolutely. And one quick reminder, please do follow the QR code here or this link and answer a very short 1 minute, absolutely no more than 60 seconds, time yourself, survey about the event. We'd love to have your feedback. If everyone would just, a virtual round of applause for our speaker.
Thank you again.
So much for joining us.
Be healthy and take care. And please don't catch the virus.
Okay, and thanks so much to our East Asia National Resource staff, Amir, Helen, Richard, and Diane for putting this on, a great event.
I echo their thanks, and they're a great team. We did a lot of prep before this, and they were very, very excellent people. Thank you.
I agree. All right. Take care, everyone. Thank you.
Thanks.